Hey, Dr. Nate here, Thrive Dental Orthodontics, and I'm gonna go through the top orthodontic ask questions. I've been getting these a ton on other YouTube Shorts, TikTok, Instagram. So let me walk you through the top questions I get asked as an orthodontist. First question is, do braces hurt? That's the one I get asked pretty much every single day. And the quick answer is no, yes. So putting on braces is super easy. You guys have heard me tell this before. All we do is we glue the braces on your teeth. There's no needles, there's no drilling. That is super easy. We put braces on like 7 and 6 and 8 year olds. So if they can do it, you can absolutely do it. So putting on braces is easy. But that night and the next few days, it feels pretty sore. It feels kind of sore in your mouth. And I kind of alluded to working out or going for a really long run. You know, at that time, it might not be too bad, but the next few days, it may be a little sore. That is kind of the same thing that's going on inside your mouth. Your teeth feel a little sore for a few days, and then it goes away. But I see you every 6 weeks. So the next time you come in, yes, it may feel a little sore again, but same thing, only for a few days. So the short answer is, do braces hurt? Nah, not that much, but it does feel sore periodically during treatment. One question I just got asked was, can you pick what teeth to be taken out? And this is referring to when we take teeth out, which you don't do as much anymore, but sometimes we have to. But the answer is nope, because the teeth that we're taking out are very specific. Most of the time we're taking out the first premolars, and we're doing that because the teeth are super crowded or the teeth are super protruded, coming forward too much, and that is the most common reason we're taking out teeth. But other reasons, we may take out second premolars, and if we're taking out second premolars, most of the time it's because you have an open bite. When you bite down, the teeth don't really come together, or maybe there's some large decay or some issues with the second premolars, or sometimes we'll take out one lower central incisor, and that's because the lowers are really, really crowded, and maybe you have small upper laterals. So there's a bunch of reasons why we're taking out very, very specific teeth. So you can't just like pick and choose. If I say, hey, we need to take a couple teeth out, you can't be like, hey, can I just take out this one or that one? No, it doesn't really work like that. There's a specific reason we're taking out very specific teeth. I love this one. It says, would you ever extract your canine or fang teeth for braces? And the answer most of the time, 99% of the time, is no. I love to keep the canine teeth in there because they're so darn important. If you have a grandpa or grandma, you may know this, but those are one of the last teeth to fall out if everything else has been decayed, because their roots are so big and those teeth are so strong. So we want to keep those things in there as long as possible. Not only that, we want to make sure everything is symmetrical. So if we take out one canine tooth here, because a lot of people have canine teeth that are, way up in their gums, but you don't take out this one, it's going to look all asymmetrical and look all sorts of funky. So in general, no, we don't take out canine teeth. I'd way rather do things symmetrically and take out premolars rather than that. That being said, you know this, we still don't take out many teeth, but no, we just don't take out canines much. We got another question from Coco. It says, can I wear my rubber bands 24/7 even though my orthodontist told me to wear them 8 to 12 hours a day? And what do you think my answer is going to be? The answer is going to be no, of course you can't do that. Listen to what your orthodontist says. There's specific reasons they're telling you certain things. Number one, if they're telling you to wear just at night or 8 to 12 hours a day, most of the time, they probably have things lined up pretty good and they're just trying to maintain it or maybe move it just a smidge. So what if you decide to wear those things full time instead of just 8 to 12 hours a day? Well, what's going to happen? That maybe those teeth are going to move over too much or to the left or to the right, or too much of an overbite or not enough of an overbite, or something's going to happen that is not the desired outcome. So if your orthodontist is telling you to wear your rubber bands only half time, absolutely only wear them half time, because you may just mess something up. Another question kind of contrary to that is, can I wear double rubber bands or double up the rubber bands? And the answer is sometimes, but you really should ask your orthodontist if this is gonna work for you. For me, I will have them wear them double up rubber bands. Sometimes, if we're in the correct wires and we're doing some bigger movements where we can use just a little bit more force, but that is very specific to every single situation. So if you're gonna wear double rubber bands on one side or both sides or just the right side or just the left side, make sure that is okay. Ask your orthodontist. Ask them. It's the easiest thing to do. Ask them if it's gonna be good for you to wear double rubber bands. How about this one? I get asked almost every day, can I choose my colors? And the answer is, of course, yes. I'm not gonna choose your colors, although some people ask me and I tell them not to ask me because I don't wanna be responsible for that. But yes, you can choose your own colors. For us, every 6 weeks when you come in, you choose your colors. You make the colors as pretty or as vibrant or as toned down as much as you want. But yes, every single time you come in, you choose your colors. And last question, how long do I have to wear retainers for? Is it lifetime? If you see my other videos, you know absolutely it is lifetime wear. For me, the first 3 months, you're gonna wear these things 24/7. Then after that, for the next 2 years, you wear just at nighttime. We say like 12 hours-ish a night. And then you wear periodically 1 or 2 nights a week forever, ever. There you have it, guys. That is what I typically get asked as an orthodontist. Most of those questions get asked almost daily. But here's a bonus. Here's something that I don't get asked is, do we wear or do we use headgear? And we actually don't really use headgear anymore, which is something kind of the past. People used to use headgear like crazy. Remember, if you see The Simpsons, if you're my age, you probably know this stuff. Or maybe your family or friends or grandpa or grandma had these before. It's like this thing that attaches to the braces, goes around the head, and looks all sorts of funky. No, we do not use headgear anymore. So I don't really get asked that much anymore. But when I was in residency, like over a decade ago, that we used to get asked sometimes, and they actually still, I think, used it. But no, we don't use those anymore, so that is good. But anyway, there you go. That is the top questions I get asked. And as you guys know, I'm trying to make videos every single week to help you be the best, most informed patient ever. So if you like this video, please subscribe and please push the like button. And I will see you guys in the next video.